The rain had been falling for hours, drumming against the glass windows of St. Mary's Hospital like a relentless warning. Inside, the corridors smelled of antiseptic and faintly of coffee, the kind of scent that clung to every corner of late-night hospital shifts. Nurse Angela Carter, a woman in her early 30s with steady hands and tired eyes, walked briskly through the ward. She had seen countless emergencies, but something about this night felt different. There was a tension in the air, an unease that no one spoke of but everyone could feel. Angela pushed open the heavy double doors leading to the emergency room, and her gaze immediately fell upon a new patient who had just been wheeled in. He was an elderly man, pale and frail, his breathing shallow yet steady. His clothes were plain, his presence quiet, almost too quiet, as though he carried secrets with him. She checked his chart and noticed something odd. The man had no listed family contacts, just a name that didn't seem familiar to anyone on staff. Despite her exhaustion, Angela greeted him with a warm, professional smile. "Good evening, sir. I'm Nurse Carter. I'll be taking care of you tonight." Her voice was calm, comforting, the way she always spoke to patients. The old man tilted his head slightly, his tired eyes scanning her face, as though weighing her character before replying. But he said nothing. He simply watched her in silence while she adjusted the monitors, making sure his vitals were stable. The hum of machines filled the room, and outside the thunder cracked again, sending a low vibration through the building. Angela noted his weak pulse, the signs of fatigue in his frame, and wondered silently what had brought him here so late at night. He didn't fit the usual picture of an emergency patient. There were no visible injuries, no sudden collapse, just a quiet arrival with an unspoken story. She felt the weight of his silence pressing against her, but she pushed it aside, focusing on her duty. As she worked, Angela didn't notice the looming shadow approaching from the doorway. Dr. William Harris, TARP, featured, and known for his arrogance, had just entered the room. His polished shoes clicked against the tile floor, his presence immediately commanding attention. Angela kept her focus on the patient, unaware that the storm outside was nothing compared to the storm about to erupt within these hospital walls. Dr. William Harris didn't waste a second before asserting his presence. He strode into the ward with his usual air of superiority, his white coat swaying behind him like a cape. The air seemed to grow colder the moment he entered. Without even glancing at the frail patient lying in the bed, his sharp eyes locked onto Nurse Angela. His lips curled into a condescending smirk, as though simply seeing her at the bedside was already a mistake. "Carter," he barked, his voice cutting through the silence like a whip. "Are you seriously checking vitals like that? How many years have you been in this hospital, and you still don't know the basics?"